Curtis, since earlier this morning, the opportunity to address some of the specifics of what they found and some of the work that they have done. I'll begin by saying that after the briefing that I just received, things are not significantly worse today than they were yesterday. They're not significantly better, but we are seeing some progress and have some plans in place to see more progress. I began today with conversations with our state leadership. I spoke with Lieutenant Governor Hoseman as well as Speaker Gunn. I gave them an update on what led to the announcement last night. They were both supportive of our efforts. I appreciate both of them and their leadership and their working with us as we deal with the challenges that persist here at this facility, but also at Fuel, and the potential risk associated with that when it comes to not only clean drinking water, but also having water in the pipes and the pumps to ensure that we're able to flush, to ensure that we have fire coverage, etc. So I spoke to the state leaders. In addition to that, I also met with legislative leaders from the city of Jackson, from Hinds County delegation, particularly on the Senate side. I know the Speaker was also doing the same with his leaders from elected positions in the legislature in the House of Representatives, and I appreciate him doing that. In addition to that, I also have spoken with Mayor Lumumba today. We had a good conversation earlier in which we worked through several items and several conversations. And I'll just reiterate, and I know the team will as well, I want to commend those individuals that have been working here at this facility, not only at the hard work that they have been doing for over many days and weeks, but also with their cooperation with this particular this exercise that we've gone through over the last several hours in making the analysis of where we find ourselves. I spoke with the mayor. I've also spoken with some of those in the federal government as well. As you know, the city of Jackson issued their emergency declaration late yesterday. The State Department of Health issued their emergency declaration early this morning. Not long after that, in coordination with both the city and the State Department of Health, I issued a state of emergency for the state sometime before lunch. And here, literally within the last couple of hours, we have sent the emergency declaration to the federal government asking the president and FEMA to declare this a federal emergency as well. FEMA has received it, and I will be talking with leadership with the Federal Emergency Management Agency very soon. This is not something that we are proud of, but we have a great working relationship with our federal partners because we do this a lot. And as you know, we had 14 federally declared disasters in my first 14 months in office. We work very closely with our federal partners at FEMA, and we plan to continue to do so. I'm not going to go into a lot of the specifics as to the specifics of what has been found, other than to say we did have a good briefing here over the last 45 minutes. I'm encouraged by, as is often the case in these situations, I'm encouraged by some of the news, discouraged by some of the news, but suffice it to say that today is not significantly worse than where we were yesterday. We do have a plan in place to potentially bring in an additional rented pump, which will allow us to pump at least 4 million gallons of water additionally, hopefully, which will be installed by tomorrow morning. That is progress. That is good. That is something that will help. Again, this is not a situation that's going to be solved immediately, and it's not going to be solved overnight. But we're going to make decisions to make incremental progress as we navigate through this. So with that, I'm going to turn it over to Mac, who is going to spend a little bit of time talking about the emergency management side of things and what we're doing outside of OB Curtis to ensure that we have both potable and non-potable water available for the 151,000 residents of the city of Jackson, plus the additional 30,000 or so that are affected by this particular event. So, Mac?
Okay. Thank you, Governor. All right, just want to update kind of what MEMA's been doing last night and today. We're going out and looking at 71 care facilities that we've got to adjust and see what kind of water pressure they have so they can take care of those patients that are there. We've already done mission assignments for law enforcement officers to pull security duty in some of our distribution areas. We're also working on, and we've got the National Guard is now mobilized. I've met with them this morning. Their teams are out on the ground assessing all of the sites that they're going to be running throughout the city. It looks like we're going to be able to augment the city's current distribution system. We have 10 tractor-trailer loads of water coming in today. And over the next days, we're going to have over 108 semi-trucks of waters coming in. So if you look at how much we're going to be able to put out starting Thursday at 12 o'clock, we're still working out the logistics of some of those locations. That will come out later. But out of those 7, we call them a mega distribution sites, we're going to put out 36 truckloads of water a day. We'll be out there for the public to be able to come and get. We've also got some other things that are going on. We have our business emergency operations center has been very, very active. We've been able to secure Anheuser-Busch is donating water as well. We've got Walmart and Save a Lot are delivering water to our logistical center in South Jackson, as well as we've had multiple calls and also fielding donations from the VOADs, the volunteers organizations, as we're working on that. So we've got a lot of things that are going on in the state. We've got a lot of inbound water to service the folks that are out at this time, and we're going to be ready to rock and roll. We've got the National Guard, their team, on the ground. Matter of fact, the Mississippi Forestry Commission is going to run the reception center or the state staging area that's going to be at the Coliseum. So you're going to see a lot of business. Had an early morning conversation. I guess the agriculture commissioner got up with the chickens this morning, so he and I were talking very, very early, and he said, I've got all the land that you need to run a distribution center out of the Coliseum. So coordinated that very early, even wanted to refill some of our tanker trucks there off the system that he has. So very proud of him stepping up and offering that. That's going to be a huge, huge push logistically for us here at MEMA. So it's kind of all I have, and I'll answer any questions once we get to the end, Governor.
Thank you, Mac. I appreciate that. And if you are a business or an individual that wants to make a donation, I'm going to give you the website mema.ms.gov. Again, if you are a business or an individual that wants to make a donation of water, etc., you're certainly, we would welcome that. We are also obviously utilizing our federal resources and our FEMA relationships to order water, as Mac has mentioned. With that, that is on the emergency management side. That is on the making sure that we have potable and non-potable water available long-term to the residents of the city. Meanwhile, we do have the Incident Command Center is set up here at OB Curtis. MEMA is certainly but it's primarily a function of the experts at the State Department of Health, and obviously Jim is representing them here today, and I'm going to turn it over to Jim.
Thank you, Governor. Just a little update on today's assessment, and this was really a very preliminary assessment here at OB Curtis, not the entire city of Jackson water system at this point. But our day kind of started with the EPA. We did visit with the EPA to kind of let them know some of the actions that we were contemplating. They were very, very supportive of anything that they could do to help in this effort, as well as if there were parts or things that we identified that there was a long timeline to receive, that they said, please let them know, and they'll be happy to try to help us get some additional things expedited in the plant. As the governor said, the incident command system is set up here. We had our first meeting this morning with officials from the city. Remember that this is a unified command structure, so there are individuals from the city, the incident commander from the health department, as well as one from MEMA. We all met this morning. Again, accolades to the team, the operators, and the maintenance folks that have been working here within this facility to keep things operating. had a very, very positive meeting with the team today. Everybody was excited about the direction of moving forward in a number of areas that need to be addressed in this plant and within the system. Just to look at the assessment team, and I want to introduce a couple of people that I have here with me today. This is Les is our Director of Environmental Health at the Mississippi State Department, Les Harrington, and Bill Moody, who is the Director of the Bureau of Public Water Supply. They're both professional engineers that work at the Health Department. There was a third engineer that was part of the team that's not here for this briefing this afternoon that went through the plant so that we could really get a good assessment of what was happening within the facility. So there are a few things that we want to let y'all know. Some of the figures that we had at the press conference, I guess yesterday, seems like that this plant is rated to do 50 million gallons per day. That is a correct number. However, the current capacity with the problems that exist in the plant is that on the conventional side, right now our maximum capacity is 18 million gallons a day, and on the membrane side, 25 million gallons a day. So as you note, that was not quite 50 million. There are some things that can be done on the conventional side that we'll be looking at and researching to see if there's ways that we can increase that output in the plant over the coming days. Today, we were able to get 14 million gallons a day off the conventional side and 16 million gallons a day off the membrane side. As you might expect, that's much less than 50 million gallons per day. So there have been some improvements in the amount of water that is in overhead storage in the tanks, which is a good thing for us. We do see some pressure coming from the plant that will need to increase over time so that we can make sure that water is pushed out through the system to some of the tanks that you will notice that are still very, very low on pressure. As the governor mentioned, one of the things the team worked on very early this morning was a plan for the primary pump that was out of service. We do have a rental pump in view, and the crane company secured to be able to swing that pump into position. We expect the rental pump to be on premises tonight and for that crew to be able to place that pump in line tomorrow. By doing that, that will increase the productivity from the pump from this plant for about 4 million gallons per day, which is going to be a good thing, again, for helping increase those pressures throughout the city. But I also share with you that, we did note there are a lot of opportunities here at this plant for some increased improvements, and that while we believe that we have improvements in view, there are a lot of things that could still break. There's a lot of the redundancy that needs to be in the plant just really doesn't exist right now. And part of that is a maintenance issue of not having enough maintenance staff to be here on site, as well as we're still short the number of operators that should be within this facility. And just right quick, I know y'all will want to know those numbers. Let me give you the... So we identified that there needs to be 6 more Class A operators here at OB Curtis and 6 more at the fuel plant. That there needs to be additional electricians in both plants, additional mechanics in both plants, additional instrument techs, as well as additional maintenance, general maintenance staff. So we'll be working with MEMA and other contractors to see just how quickly we can bring those type of resources into the state so we can begin helping to augment the staff here at this plant so that those maintenance issues that need to be addressed can be addressed timely. And Governor, I think that's my comments.
Again, thank you. The way I would describe the last piece that Jim gave with respect to the operators, we're not talking about a large number of individuals. Clearly, they have very specific skills, and those very specific skills are very much needed at this facility and otherwise. The way I think about this is the same way that I think about what we had to do approximately a year ago when we had to augment staffing in our hospitals. If you'll remember, State Department of Health did an analysis. They told MEMA that we need this many physicians that can do these types of physicians. We need this many types of nurses. We need this many types of nurse anesthetists. We need this type of respiratory therapist. And MEMA then, through their procurement processes, went out and secured those. It wasn't wildly popular with everyone, but we were able to get the job done. And that's a similar process that will take place over the next several days. State Department of Health, again, working together, will identify exactly those numbers that Jim just mentioned. They will work with MEMA. Their procurement specialists will go out and procure it, and then we will get these operators in. Again, I want to reiterate that the individuals that have been working here at OB Curtis have done yeoman's work doing what they have done. There just hadn't been enough of them. And that is something that's critically important. I think we are all in agreement with respect to that, and we're all going to work to augment and supplement the work that is being done. So with that, I'll turn it over to y'all for questions, and we'll start with Scott.
Governor, why did the plant fail? There seems to be some miscommunication. I just want to know. Was it because of the flooding event, or was it because of the pumps just dying? I mean, what happened?
What I would tell you is that in our conversations with the Department of Health earlier today, we do believe that the flooding event certainly put additional strains on this particular treatment facility. The significant additional rainwater north of the reservoir, which then came into the reservoir, clearly, and I'll let anyone address this that can speak more technically than me, but basically the additional rain difficult to get clean water out of the system.
So think of your swimming pool. You know, you have a certain pH that you keep in your swimming pool for your chemicals to be able to do the things you need to disinfect to keep your swimming pool clean. Same thing with that much additional rainwater, just like you get a bunch of rainwater in your swimming pool. It messes up the chemistry. And the ability to make the water that you want to push out of the plant had to probably hesitate while they adjusted for that. And that hesitation, when you're producing this amount of water every day, is costly.
So the pumps were already broken down before this change in the chemistry of the water.
Remember, those are raw water pumps. So that's the raw water pump that's pulling the water in. It still has to be filtered, disinfected, and placed into distribution.
So did any raw water get pushed out into the water system? The governor had alluded to that might have been happening in the case. The mayor today said no untreated water was pushed out. Can you clarify?
Well, there was water that was not optimally treated would probably be a more correct statement. As far as raw water, there are filters, whether you're on the membrane side or whether you're on the conventional side, that do settle a good bit of the water out. So I wouldn't say it's exactly raw water from the reservoir, but it obviously, since the chemistry was not in balance, it was not properly or optimally treated for consumption.
To your first question, Scott, I just want to reiterate that sometimes the answer can be both and rather than either or. And so clearly there has been issues here at the plant with respect to pumps and optimal the pumps working optimally. And so I would submit to you, based upon the information that I have today, which is the best information we have, and we're continuously gathering, that the answer is most likely both and. We find ourselves where we are today, both and. Both the additional flooding and rainwater in the reservoir certainly contributed to the lack of optimal water coming through, and the fact that the pumps are not working optimally also is a challenge, which is why after we got in and did the analysis today, we have a pump coming in that will be set tomorrow to help push out, I believe, 4 million gallons per day, an additional 4 million gallons a day, which if we did 30 million total today, that's about a 13% increase over where we were if all other things hold. But there's a lot of other factors out there. The other thing I'll just mention, I think it's a more correct statement, much of the water that got through the ultimate filter system was somewhere between raw and not clean, none of which is, regardless of where it falls on that scale, none of it is ideal. Yes, sir.
Governor, as we talk about these solutions that you guys are coming up with, the repair of the plant, people need water today. Distribution centers are running out of water with people lined up and being turned away. What's your message to the people that had to leave empty-handed today? Secondly, how many days can the state distribute water the way you plan to do so under this emergency situation?
Well, there's no question that the distribution of both potable and non-potable water in a city of 151,000, moving it from the system that has been in place for many years to a system in which we literally have individuals physically handing out water is not optimal. It is not ideal. But it is better than the alternative, which is to do nothing. And so, obviously, because we had a fairly large number of cases of water in our warehouse, we've been able to take the distribution system that the city already had in place, primarily at fire stations. Primarily, they were at fire stations because that is what the EPA mandated. We started early this morning with conversations with the EPA to expand the distribution away from just being at fire stations. And we're doing that for a couple of reasons. Number one, many of these fire stations, while they are geographically diverse throughout the city, they're not in ideal locations in terms of moving many automobiles through. The second reason for that is obviously if automobiles are coming through the fire station and there's an actual fire, it's hard to actually then get the fire units out to go fight the fire. And so we're working through those issues. We've always said that in any emergency, we encourage everyone where it is possible to have 72 hours of supplies on hand. We're hopeful that a large number of Mississippians and a large number of those in Jackson have those 72 hours of supplies on hand. And for those that don't, check on your neighbor. I'm saying to everyone in Jackson, check on your neighbor. We know when we have shut-ins, for instance, that may be living next door to us. We know as Mississippians when our neighbors maybe can't go out to the grocery store for whatever reason. We also know that there are probably going to be the potential for shortages and whatnot, but we do have water in the system. We are putting it in the city's distribution system, and over the next 24 to 36 hours, we will see significant numbers of the truckloads of clean water in bottles that we ordered as early as yesterday starting to be delivered to the city of Jackson.
So the water,
Governor, y'all have mentioned gallons per day and everything. Any estimate on like how many households without water, how many families, how many people in those terms, or even area?
So it's really virtually impossible to tell you the potential number of houses. What we do know is that there are 10 tanks, approximately 10 tanks that are served by this particular facility. Of those 10, approximately half of them have very low water levels. And if you live or if your business is near one of those 5 tanks that has a relatively low water level, it is likely that your pressure is much less than ideal. Now, again, I can't tell you specifics as to where those are. I don't know if anyone wants to address that any more clearly, but we do know that we do not know exactly the number of households, and it's virtually impossible for anyone to know because it really just depends upon where you are, how much water is in the tank, how close you are to the tank, what your elevation is. Obviously, for instance, in downtown, if you're on the 7th floor of a building, it's much less likely that you're going to have adequate water pressure than if you're on the bottom floor of a single-family residence. And so,
is the water safe to bathe with right now? You said don't drink the water, obviously, but can you bathe in it right now? Is that?
Do not drink the water. I want to be clear. Please do not drink the water at this time. I certainly think it is, but
Yes, just to answer your question, Scott, yes, it's safe to bathe in. If you take a shower, just remember you don't want to take it in internally, so don't open your mouth while you're in the shower and take the water in. You should boil water that you're going to consume. That's the real message to everybody. You know, especially for those infants, anybody that has immune system compromised, some of our elderly people that their immune system may not be functioning in high gear anymore. It's very, very important that they boil that water. Everybody should boil the water, but it's very, very important for those high-risk immune folks.
I want to hold on to questions.
Well, let's go right here and we'll come back to you.
Now that the state had a chance to get in and set up this command center, is there any estimate on when this water will be safe to drink again?
Well, I can't give you a time frame as to when we will be pushing out safe drinking water. As Jim said yesterday, the way in which we get to that point is we have adequate quantity coming out of the 2 treatment facilities. We are then able to do 120 samples, and at 120 samples over a 2-day period, 121 day, 120 day 2, 100% of those come back clean. Throughout the last 30 days, we have had days in which we had 120 come back clean, but there's not been a day in which we've had 2 consecutive days in which all 120 came back clean. The challenge that we're dealing with is we have identified a number of challenges here in the plant that need to be fixed. We have identified a number of projects that need maintenance personnel to work on them. We've got to get an adequate number of proper personnel in to do that maintenance, and that's something that we're working to source. Even as we speak, we have procurement specialists at MEMA doing that. This is what they do, and they're very good at it. They do it during hurricanes, they do it during tornadoes, they do it during COVID, they do it during natural disasters, they do it during emergency declarations, and they will do a fantastic job finding these individuals. But these individuals don't necessarily live in Madison or Rankin counties where they can just drive across the spillway here. We may be sourcing these individuals out from other parts of the country, and we've got to get them here, and we've got to, and obviously that's not cheap, but it is, we think, a worthwhile expense to get the water back running. I can't give you a time frame because the reality is I can tell you when we are likely to fix one piece of this puzzle, but there also is always the possibility that there's another piece that breaks, and so we're going to have to navigate our way through it.
So much speculation about price tag on this work, and the city will have to bear half of that in some form or fashion. Are you getting some idea? Are you going to have to buy new pumps? Do you have any idea of price tags on what you're looking at on some of these key pieces of equipment?
Yeah, so what I would tell you is the plan that was presented to the mayor with respect to a 50-50 match was just, and this is what I told the Lieutenant Governor Speaker today, that was just simply because that is the policy of the state with respect to ARPA funds. So the state of Mississippi has made it their policy that for infrastructure needs, the utilization of ARPA funds would require $1 of local funds, $1 of state funds. Some of these expenditures going forward may fit into that category where they can be funded with ARPA funds. Some of these things are going to have to be navigated throughout the process. We have our procurement people as well as our financial people working to ensure that we identify the best way in which to fund these expenditures. We are hopeful that the president approves my emergency declaration today and approves a federal declaration that will also free up federal resources to help us throughout this process. And we think that is likely to come. I'm hopeful that it comes sooner rather than later because this is clearly a disaster. The risk associated with the state not creating the Incident Command Center, the risk associated with the state not doing what we are doing today and briefing you, and the potential for toilets to not flush for weeks and weeks on end, the risk associated with there not being fire service in the city, in addition to what we already know were the risk associated with not having clean water in the city since July 29th, now 31 days, was such that these emergency declarations were warranted.
So no price tag, like 30 million, 50 million, you're guessing?
I don't want to put a price tag on it. I don't think it'll be more than that. I don't think it'll be more than either one of those numbers based upon what our current projections are.
Governor, we've heard some conflicting info on when this became evident or imminent. I think you guys last night were saying perhaps up to a week. You figured there were issues here about to become dire. I think the mayor may have said he didn't figure it out until yesterday. What's going on there? Could people have been given more of a heads up this was coming?
What I would say, Jeff, is that the health department came along with MEMA and met with me on Thursday of last week and addressed some of the challenges that we were seeing with the pumps inside OB Curtis. Again, we didn't have visibility inside the facility, but there are a number of readings that the State Department of Health look at that gave them reason for concern. But to be clear, there was, I don't know what y'all call it, Jim, but in 2016 you issued a compliance plan asking the city to comply with certain measures to get back in line with compliance, because when it comes to wastewater, the EPA is in charge at the federal level and the Department of Environmental Quality is in charge at the state level for compliance and regulatory issues. When it comes to clean drinking water, it is the EPA in charge at the federal level and the State Department of Health at the state level. And so you could say that some of these issues have been outstanding since 2016. Having said that, the additional amount of rainwater and what that did to the reservoir in general, which ultimately came, some of that water came through the plant, and the needs that occurred because of that in terms of the chemicals here inside the plant. I don't think a lot of that came into to be known, at least to some of us, even if I'll say yesterday, but it may have even been today, because again, we didn't have visibility inside this facility until the Incident Command Center was set up this morning.
Question for Dr. Craig.
Okay.
The conventional filter side of it used to be the maximum capacity was 25 million gallons. And you said just now it was 17. Why the difference? What changed?
So I'll give the non-technical answer I think is right.
Please.
I'll encourage my team. We do believe that there's some filters that are part of that process that have been offline for quite some time now, and that is the reason that the actual production level of the plant is less than what needs to be. We're looking to see exactly what remedies it will take to get those two filters back online. And we believe that once that is accomplished, then we should be able to see more production on the conventional side as well.
So you might be able to get back to 25.
Oh, yes, sir. It's possible. Very possible.
Governor, you met with the delegation, you said, at least the Senate side today. They've called for a special session. Any potential for that at this point?
Jeff, what I would tell you is that we've got a short-run issue before us, a crisis, an emergency, for which I have requested a federal declaration, federal emergency declaration, and that is what we are focused on 100%. The legislature will have an opportunity to weigh in from a policy standpoint on the potential intermediate solution as well as a long-term solution, and we committed to both the Lieutenant Governor and the Speaker today to work closely with them as well as the delegation with them to try to find an intermediate term and long-term solution and exactly what role who needs to play in that. But for me, my focus is exclusively on the immediate crisis at hand, and we will work on the intermediate and long-term solutions at the appropriate time. Look, I want to thank our team from the State Department of Health, from the Mississippi Emergency Management Agency. I appreciate the city and their work helping as they are doing these analysis on this particular plant and ultimately on the fuel plant as well. We appreciate what they are doing. It is not easy work. and there is a risk that while things got a little bit better today compared to where they were yesterday, there is a significant risk that could change, and we could have hiccups along the way. We know that. I want to be clear to everyone in the city that is possible, and we want to encourage our fellow Mississippians to look out for yourself, but also look out for your neighbors. Again, I think most Mississippians know where our elderly are, where those are who need some additional help. Please check on them and do, and please be willing to help them if at all possible. So with that, thank you all for being here. We'll have another opportunity for another briefing soon. We want to make sure we give you adequate information. Stay safe out there, Mississippi, and God bless.